If you've had RK surgery, then you need to choose this lens for cataract surgery. Hey, Dr. Shelby here with See Better MD. Let's talk a little bit about cataracts and RK. RK was a wonderful procedure back in the day to treat nearsightedness. So before we had LASIK or PRK, patients would come in, we'd make little radial incisions in the cornea. And what that did was that helped to flatten out the front surface, which reduced the nearsightedness. It was wonderful, and there were millions of the procedure performed. Now, that was decades ago. So now we're beginning to see all these patients come in. They're older. Not only have they had RK, but they're beginning to get the symptoms and signs of cataract. So one of the issues is, what lens should you choose if you've had RK? RK patients generally have a higher demand on their visual outcome because they paid for RK back in the day to get out of glasses. The problem with radial keratotomy is there's a fluctuation in the corneal curvature throughout the day. So it's very hard to measure precisely the curvature of the cornea to pick a lens to put you in perfect focus. One of the issues that we see with the standard lens or the toric lens or the panoptics, the multifocal that we use, is there's variability in outcomes. There's also what we call higher order aberrations in the cornea. So what this means is that once we did cataract surgery, patients didn't end up exactly where we or they expected them to be. What does that mean? Well, a lot of times if we chose to make them perfect at a distance, their vision may be a little bit nearsighted. So their distance vision was blurry, or their near vision was blurry, or they were left with a lot of astigmatism that was unanticipated. The only way a patient could see well after cataract surgery having RK is just a pair of glasses. Well, that can be frustrating. So the best way an RK patient can get out of glasses after cataract surgery is with monovision, meaning one eye for distance and one eye for up close. Of course, the brain blends those images together, so effectively your glasses free. You can read up close, you can see your computer, and you can see distance without glasses. Now, for RK patients who want to have those type of results, the best way to do that is with the light adjustable lens. The light adjustable lens is implanted at the time of cataract surgery in both eyes. Generally, what we like to do is the dominant eye we maximize for distance, and the non-dominant eye we maximize for intermediate and up close. So theoretically, the patient should be able to see distance, intermediate, and near without glasses. But like I said, the issue is there's variability in the outcomes of RK patients. So the reason the light adjustable lens is the perfect choice for an RK patient is because once we have that lens implanted after surgery, we allow it to heal. Once it's healed, then we do a refraction. You know, what's better, one or two? And then we tune up that distance vision. So we correct nearsightedness or astigmatism or farsightedness. Once we have that number dialed in to where that patient is seeing perfectly at a distance, we simply dilate the eye and we shine a light on there with that prescription in it. What it does is it changes the polymers of these lenses to match that refraction. So once it's done, that distance eye sees perfectly at a distance. We do the same thing with the near eye. So we adjust that refraction, what's better, one or two, for the near vision. And once the patient says, wow, this is great, we dilate the eye and we shine a light on there with that refraction in it so we can tune up that near vision perfectly. The benefit is that it's not a one and done. So if we need to, we can make little adjustments before we finally get to the point where the patient says, this is wonderful, I love this, and then we simply lock it into place. Once it's locked in, those RK patients will then see better than they've seen since they've had RK, being able to see distance and up close without glasses. That is the reason that the LAL, the light adjustable lens, is the perfect option for post-RK patients for cataract surgery.